Mhm. Okay, so today I am presenting on dry needling. So this is a very high level explanation, but just dry needling is something that got passed recently in Florida as a treatment for physical therapists to be able to do. So I wanted to kind of give information on what it is so that you all had an idea. I think it's kind of new in general for people. So here we go. So what is it? So it is a technique that's used to release trigger points in muscles. So trigger points are hyperirritable spots of a skeletal muscle. So if you were to like run your fingers over really your upper traps, there's always a lot of them there. And if you go and you feel like a part that feels thicker than the rest of it, or a part that has a bump in it, so that would be considered a trigger point. And so you would be using these acupuncture needles to be inserted into the skin into that trigger point. So anywhere that has these like hyperirritable spots associated with hypersensitivity. And so we'll kind of go into.
So if I did the Macarena, every prayer I press is a hyperirritable spot, right?
For you, maybe.
Like a Macarena.
It could be if you, it depends. No, it depends how, possible. Okay, so more about trigger points, because I know it's not like something everyone knows what it is. So they can be active or latent. So like for myself, I know I can go and feel all in my upper traps and feel a lot of knots, but I don't have any pain from them. I don't have any issues. So that would be considered a latent trigger point. So they don't cause pain unless they're stimulated. Like if someone were to dig their finger into it, I'd probably feel pain. But they can alter muscle activation patterns and contribute to a limited range of motion. I thought this little joke was funny.
Your trigger point
is so relaxing. Not okay. And then active trigger points can spontaneously trigger local or referred pain, can cause muscle weakness and restricted range of motion. So sometimes it's something as simple as like literally if it's this area, they have pain here, and that can be from trigger points, but also I'll kind of go into more in a little bit. If you push here and people can get referred pain into their head. So a lot of times people get headaches as a referred pain from the upper trap. So it doesn't have to be at the location of the trigger point.
So this is, all right, so seriously, when it's time to go to bed, sometimes when I lay on my side, because I had high blood pressure issues, I literally thought like right here in my head was going to explode. And I thought it was blood pressure, but I think it was just a trigger point, maybe from my neck or something.
Probably, yeah. If you lifted arms that day, maybe especially, or your posture was really bad that day.
Okay.
Work. Yeah.
All right.
But you should probably also take your blood pressure if you fly away. I mean, seriously, just make sure. But yes, it can definitely be. So like this specific spot, can really be from the neck.
It only ever happens on one side.
How often does that happen? Okay, maybe we can talk about this later.
Right.
Okay, so more. So this was exactly what I was just talking about, actually. So these areas can refer pain back here, up, and then even into the jaw. So it can almost replicate like sometimes like heart attack like symptoms. But so trigger points are produced as a normal protective mechanism for the muscle in the presence of actual or potential muscle damage. And so what the problem occurs is when it's sustained. So, the pain normally happens if the trigger point stays around for a long time. So it's thought to occur in response to unaccustomed loading. So like I have a patient right now who she's got this shoulder pain from trigger points back in here, but they had gotten like a new dog that was like a big dog, and she was trying to control it on the leash a lot. So that's like an eccentric control of the muscles in her shoulder, and that was like repetitive. It was new, it was higher load than she was used to, so that caused some of these hyperirritable trigger points, just as an example. So sustained posture, like you were just talking about, Jesse, so more than likely it would be like posture during the day. So I know for myself, I get this pain here if I've been sitting at the computer, like because these muscles all get super tight. So definitely sitting with bad posture for a prolonged time makes it worse. And then repetitive low load. So just kind of like doing things over and over. That's more like job types typically. And so then when they're sustained is when they cause pain. So there is a decrease in oxygen and a decreased blood flow in that scenario. So I think I used the example before where it's like a washcloth and you wring it out and then it like dries in that wrung out position and it's all like crusty and gross. So that's kind of what happens to the muscle when it's when there's a lot of blood flow, that it's like a moist washcloth, but when it's wrung out and dry, that's like where the decreased blood flow and oxygen, and then it creates those trigger points. So just for a visual. So indication, so why would you need to get dry needling for these trigger points? And so if it is spot tender over that area, if you can, like if someone was coming to PT and they said they had pain here and you could push on a muscle and you could feel the trigger point and that was a reproduction of their pain. So which is kind of like same thing, indication of a jump or shout sign. So you push on something and literally people jump or shout. Yeah, so that's pretty much what that means. And so there are techniques we can use besides dry needling for this. Like, so there's like soft tissue massage. You can use different kinds of tools, but we'll go into like what the dry needle actually does in a second. So contraindication is needle phobia, shockingly.
What the hell is contraindications?
Oh, sorry. So contraindication is like in a scenario where you absolutely don't want to use this technique. So there's like a full contraindication, which means like you definitely don't do it, and a relative, which is like maybe don't do it. But
okay,
I just put the full ones. So if someone is afraid of needles, you don't want to do this, which makes sense. And if they're unwilling, like they don't want to, I mean, these are pretty basic, but that makes sense. Also, you don't want to do that. Or unable to give consent. So someone that has like some sort of brain injury or something where they don't understand you or they literally can't physically consent, you definitely have to have that for this. And then lymphedema, which is like swelling in the extremities, or well, it can be anywhere, but swelling, because you can imagine if there's extra fluid, that might not go over so well if you put a needle in it, you know. So
makes sense, yeah.
Okay, so the suggested mechanism, and then I have a video that just like is a demo of what it looks like to show you. But so I don't think it's 100% known, but so they think it stimulates, and it does, I've felt it, stimulates a local twitch response. So when a needle is put into that trigger point, the muscle like spasms and then it like releases. So it's very interesting. So an involuntary spinal cord reflex contraction of the muscle fiber is just a fancy way to see it, like it jumps essentially, and then it kind of lets go. Which decreases the pain-provoking substances in the environment. So it's like at a cellular level. I didn't want to go into all that, but it decreases the pain level through the different things that are floating around in the environment.
How far do these needles go down under your skin?
I think it depends which muscle you're using, but I think it's 5 to 10 millimeters.
How far is that?
I don't know,
like pinky nail length, sort of?
That would be like the most, yeah.
Okay.
I think that's like 10 centimeters.
I'm about to be a contradiction on this one.
So, and then another thought process is muscle regeneration. So needles potentially cause a small lesion within the muscle, which triggers like cells that help with healing to migrate to there. But typically it's like this local twitch response. I think I'm going to just show that video at the end because I don't have many more slides and I'll have to share a different screen. So just come back to that in a second. So these are examples of how trigger points refer to other areas. So I think it pretty well understood like what a knot is, which would be the same thing as a trigger point. And it makes sense to people that there's pain in that area, but the referred to other locations is what I think is missed a lot and not understood by the general
population. So wait, is the X, explain, so is the X where the referring
so I will
from
to explain
pain?
This diagram now. So yes.
Oh God.
So,
I'm a paying customer, okay.
Well, I hadn't explained it yet. So the X's are where the trigger points would lie. So where I would actually find like that ball of muscle, but the red is where the person would have pain. So like if you get pain along this area, for example, so this is a really kind of a common presentation for like sciatic nerve. So if someone comes in with that, you would want to rule out a trigger point here in the glute med muscle, because if I were to push here and you had one, it could cause pain in any of these locations. So, Same thing here. So these X's cause pain here. So a lot of times this is kind of not thought about as much because we think at like a deeper level, but muscles can really cause pain and other reasons. So this is an example of these muscles. They're deep on the front of the neck. These are another one that get really irritated with posture. So pushing on these X regions, and you can get pain into the chest and pain all the way down the arm and into the hand, back in the shoulder blade. So this was one I was thinking Jonathan would actually relate to because I know he gets some of that. But so yeah, so I think that's probably the most interesting thing. And so there are different apps. I have an app on my iPad at work actually, and it shows you like if someone has pain in an area that doesn't really fit a typical pattern for like a dermatome, which is based off like a disc in the neck or something, and it doesn't really fit what I'm used to seeing, I'll go to that and it goes by region, and then I can look and see where the trigger point, like the options for the different muscles and trigger points and how that refers, and then I can kind of compare. So if I push on this area where the X is, I should reproduce, and it's not always all of them, but if I reproduce the pain where they have it, then likely that is the cause of their pain. So in scenario of dry needling, you would want to dry needle that area and get that trigger point to release.
So is dry needling only really supposed to work for helping with like preferred pain, or does it help like, I don't know, like, is that where it's most effective?
It's most effective with trigger points. Yeah. So it's like a muscle.
Yeah. Trigger point. Yeah. Okay.
Yeah. That's all it does. It works with. Yep. So it's not like this is the only thing you need, most likely if you go to PT, for example, but it's an adjunct. So it releases those trigger points much more easily. Like if I would try to manually with my hand, try to get a muscle to release, it would take a lot more time, effort, everything, and probably be less effective than.
But a trigger point's like the guarding, right? I guess what I'm saying is my hand is still hurting. Like it's now March, and I wonder if I could use this to get something to release to help with the soreness.
Yeah. Yeah, because sometimes the trigger points last after the injury. It's guarding and all that kind of stuff is hard to get it to go away. Sometimes if you have to break the cycle. So yeah, I mean, I'm not sure where you would get it yet, but yeah, it could help. So if you get because they would be like up in the forearm and stuff, probably for that.
All right.
I think that's all I got. So let's exit this and I'll show you this video. Oh, I think I need to stop share. And then, so I just thought it would be interesting to show you what it looks like. He talks a lot about it, but I just kind of want to show what the needle looks like here. Hopefully you can hear.
Volume's not coming through, but I can see it. Can you usually feel that when it's happening?
Yeah.
What's it like?
So you can feel what he was saying is like so see that twitching that's happening?
Yeah.
So you definitely feel that. It's like kind of feels like a muscle spasm.
Almost like when I've been hooked up to the like stuff for my knee, like
stem. Yep.
Yeah.
When it like makes it contract. Yeah.
I'm not gonna lie, I kind of always thought dry needling might be BS, but if it makes you do that, then I know it's not.
Yeah, it definitely works. You have to know what you're doing to like get the anatomy and like get it right. So what he's saying is, sorry, I didn't think about the sound, but so you like pinch the muscle, you put it in, and so then you had to palpate first for those like taut bands where the knot is, and so then you're going in at different directions, and when you see that, you're going for that local twitch response. So he got several of them. So.
Cool. All right. Well, it definitely validates something that I wasn't sure if it was
Nope.
witchcraft or not. It's cool.
Witchcraft. Yeah, so that is dry needling, is very high level description of it. And yeah, so let me stop